Good evening, everybody. I did have some slides, but in the interest of time, I think I'd just like to make a few key points. And the first one is obviously to welcome the launch of this conference and publication series. And from a patient perspective, initiatives that promote dialogue, promote debate, and give us an opportunity to develop tools and share evidence and information to promote patient and person-centred healthcare are really important. So this is a very welcome initiative, and we hope it can help to bridge this gap that we know we have, which is between the rhetoric of patient-centred healthcare and the reality. So the implications for patients, certainly if you think whenever we talk to our member organisations, there are 200 IAPO members from over 50 countries, their top priority when you talk about healthcare, actually, while access and other areas are very important, they always say it's the relationship I have with my doctor. That's the most important thing. So the ideal that we are working towards is where we have a better relationship, an equal relationship with healthcare professionals, where healthcare professionals have the scientific, the medical knowledge and expertise, and the experience and the knowledge that the patient has about how treatments and how therapies will affect their lives and their quality of life are also considered, and that these decisions are made in partnership. So overall, in terms of the implications for patient-centred healthcare for patients, obviously it's a positive thing, the more we can support its implementation, but it's not just important for patients, it's important for health professionals, it's important for health systems, it's important for the WHO and countries around the world, because with chronic conditions in particular, but generally with healthcare, patients need to be involved in decisions that affect their lives in order to make healthy lifestyle choices, in order to adhere to treatments. And the only way to do that is with their involvement and with a person and patient-centred approach. But there are so many barriers. We're talking about patient-centred healthcare. It's written down in policies. It's, you know, we hear about it. It's the buzzword everywhere. But there are so many barriers to its practice. And I think initiatives such as conferences and journals where we have this opportunity for dialogue are very important. They can help to build understanding, help to also address a change in mindset, which can only be achieved through dialogue and through also sharing evidence and information about the value of patient-centred healthcare. And the other thing that I think is important at this stage is also that we start helping all of us together to change the concept of patient and person-centred healthcare into models and tools which can make it used in real life. So my final point is that in our efforts around this, we do need to have a collaborative approach. And it's very welcome that there are health professionals, patients, and others involved. And I just wanted to make the key point that patient engagement is central to these efforts, and we mustn't miss that point in these initiatives. Patients and patients' organisations need to be involved in all of these aspects of healthcare decision-making and policy-making in order for them to be effective. And also there needs to be the patient involvement and the patient empowerment to be involved at a personal level in their own healthcare. So we mustn't lose that point. But sometimes it can all seem like an uphill struggle. So I wanted to just share with you one of my favourite quotes, which I always find quite motivating, which is from the American anthropologist Margaret Mead. And she said, "Never doubt that a small group of thoughtful, committed people can change the world. indeed is the only thing that ever has. So I think hopefully that can motivate all of us. And I'd like to again say congratulations on the launch, and that we look forward to further collaboration to help to bridge this gap and make patient-centred healthcare a reality.